Good morning, everyone. Thank you so much for joining this morning. I really appreciate you taking the time out of your busy days. So this morning we are going to be going over some Medicare steps along with Medicare tools and resources to use for Medicare. Along the way, I will open it up for discussion, questions, comments, also the little chat icon that you see on your screen. Feel free to write anything down in there and I will get to that along the way as well. So as you know, very casual, so speak up. I put together a little cheat sheet that I feel is very helpful for myself. And I also have sent this out a while back. I know some agents do use it and they feel it's very helpful because, as you know, when it comes to Medicare, there are several different steps that we must use. It's required. And there are so many different tools and resources that we can use along the way. So I thought this may be helpful to show you how to get to and from. Each agent has their own way of doing things, but this may help to make it a little bit easier for you. So I hope you guys take something from this training. All right, so to start things out, so as you all know, or most of you, some of you are new on this training, very, very important when it comes to Medicare, scope of appointment. Scope of appointment, we get signed, whether it's in person or electronic. And that just allows us to talk to our Medicare Advantage and standalone prescription drug plan enrollees about what we have to offer. They initial, they sign on the back, and we will get to that here shortly. So I'll show you what that looks like. And then what's very, very important is our enrollment checklist. And what our enrollment checklist does is to make sure that we as agents do our job. We have access to that also in person and electronic version as well. And on that electronic or that enrollment checklist, it has the provider search. So when we're looking up providers that our members or our potential members are using, it allows us to write those providers on the enrollment checklist, whether or not they're participating in the network and the address of their location. Also drugs, so when we're doing a formulary search and they take certain prescription drugs, that enrollment checklist allows us to write those prescriptions on there, whether or not they're on the formulary, what tier they are on, what cost they're going to be, and so on and so forth. And then there's a whole bunch of questions on that enrollment checklist as well to make sure that we've gone over all of the necessary requirements and they understand what they are enrolling in. So we want to make sure we get yeses on all of those questions when we go through it. So this is for us as agents. So like in the future, if there's anything that ever comes back on us, we can provide to CMS or Florida Blue and Florida Healthcare Plans that we had gone over the enrollment checklist with our members. We searched their providers, we searched their drugs, they answered the questions. So we are just protecting ourselves in a sense. We also want to make sure we're going over the summary of benefits in detail with our members. We want to explain the drug coverage stages in detail, and all of that is in the summary of benefits as well. The member star rating, which is in our summary of benefits, and then we're always going to enroll our members through our agent point, okay, which is through the quote Florida Blue tab. And then of course, we want to make sure our members have our card, our contact information. That is one of the questions in the checklist. Does your member have your contact information? So make sure if they don't, you give them your contact information. If you're not with them in person, make sure that they have it. You know, whether you're giving it to them over the phone or whatnot. Okay. So that's just a quick little, you know, step-by-step that I like to use just to make sure that I'm going over everything that needs to be going over with a member or a potential member when it comes to Medicare. So these tools and resources that I like to use for Medicare, this cheat sheet that I put together, I put the links next to each one. So it's a quick and easy way for you guys to access it. And then when you click on the link, you can also save it in your computer as a bookmark. So you'll always have easy access to get to these links. And again, these are just tools and resources that myself and other agents use to do their provider searches, to do their formulary lookup, just to get to and from where they need to when it comes to Medicare enrollments. But always remember that no matter what tool and resource that you're using, that when it comes to doing the actual enrollment itself, the application, you're doing it through your agent point through the quote Florida Blue tab. Okay. All right. So right here, Medicare enrollments, this link right here where it says agent point is going to take you right to your agent login. Okay, so we'll get to that here in a little bit, but we're going to move straight to where we would do our provider searches. All right, so moving forward. So Florida Blue and Florida healthcare plans, they have separate provider searches. So when you're doing a Florida Blue Medicare, you're going to go through Florida Blue's provider search link. And then Florida healthcare plans, they have their own provider search site as well. So I put these two links, which will take you right to each of their individual provider search. So if you click on here, it's going to bring you right to Florida Blue. So if you click on that link, it's going to take you right to where you want to find a provider. Okay, so from this page, you're going to scroll down to find doctors by plan. So if you're looking at specific Medicare Advantage plans for your member, they're towards the top when you click on that drop down. So depending on, because as you know, Florida Blue has several different plan options to choose from, you want to make sure that you're clicking on the appropriate plan. So if you're looking at the Blue Medicare Regional PPO, you're going to click on that to do a provider search. If you're looking at the Classic Plus, you would click on that. The Patriot, so on and so forth. So we're going to click on the Premier plan here. So once you click on that and you select continue, it's going to bring you to this page where you can narrow it down even further. So you can narrow it down by entering the location, either the zip code, city, state, or street address. So if we wanted to do zip code, we'll do 33062. I'll do a Broward County zip code. And then you can narrow it down even further. So search within a certain vicinity. So we'll do 20 miles, but it goes all the way out to 100. Now, if they have a certain provider that they use, you can do a provider search by starting to type in like the last name, the facility or condition. So we can type in, we'll just type in a common name, Dr. Smith, just say. So as you start typing it in, you'll see that it will automatically populate, and you can try to find that doctor within this list here, which is nice that they incorporated this option. It didn't have it in the past. Now it does, which is super user-friendly, which I love. So we'll say that their primary care doctor is Dr. Sonia Smith, family practice, and you would select on that and it would bring you right to her page. Okay. So from here at the top, it shows, her information here. And if you scroll down just a little bit, it will show the contact information, address, whether or not she's accepting new patients, which you'll see she's accepting all patients. It also gets into more detail a little bit, the office hours, what physician group she's affiliated with. If you keep scrolling, her board certifications, eligibility, also different locations. And then even further below, it also tells what other plans she accepts. So if you're kind of contemplating between a couple different plan options, when you scroll down to plans accepted, it will show all of the Medicare plans that she does take. So as you can see here, we start with Blue Medicare Choice. So she takes the Choice PPO, the Classic excluding Miami-Dade, the Classic Plus, the Complete, the Patriot, the Premier Miami-Dade, the Premier excluding Miami-Dade, the Saver Select Value. So she pretty much takes them all when it comes to Florida Blue. So if you're, tallying between one or more plans, that's a great way to see, what plans she does take if going between more than one. All right, so if we go back, if a member does not have a provider, just say, and they're trying to look for a certain provider, again, you can type in zip code, vicinity within, and then you can do a search for the provider type. So just say they're looking for a specialist within 20 miles of 33062, and they're trying to find a cardiologist. It allows you to narrow it down by specialty type. So you can click on cardiology. You can narrow it down even further. So if you're looking for a gender, whether it's male or female, you have that option. Language, if you want to choose a Spanish speaking doctor, a Creole speaking doctor, you have that as well. Accepting new patients. So if it's someone that you're trying to get into, you need to make sure they're accepting new patients. So you can always click on that as well, accepting new patients. And then here's other programs that they offer, like what you're going to see most often is value choice providers, which allows for, depending on what plan you're enrolling them in, is lower copays. So you can narrow it down even further that way. So if we wanted to click search now, it's going to bring up all cardiologists within 20 miles of 33062 that are accepting new patients. So as you can see, there's quite a few of them. So you can just scroll through. Some of them do have reviews, as you'll see, like the stars. This is something newer within the last year or so. But when you click on the actual provider, it will bring you to where the details are as well that we just went over. And then again, if you scroll down, it's going to show you all the plans that the provider accepts as well. So it's pretty simple for the most part. I will say every now and then, providers are not being updated within the system. So sometimes you may come across one that shows that they are in the network, but they are not in the network. Unfortunately, that does happen sometimes. So maybe going that extra mile for your member and calling the provider just to make sure they are in the network, especially when it comes to Medicare, you can always go that extra step for your Medicare member just to be on the safe side, because we don't want any, discrepancies to happen in the future where we say that the provider is in the network and then all of a sudden the provider isn't as soon as the plan goes into effect. And then we're like, uh-oh. So going that extra mile for our Medicare members is always a good thing. It definitely doesn't hurt. Does anyone have any questions regarding that? Or any comments?
I have a comment, but you might go over it later.
Yes, go ahead, Robin.
I was just gonna say, for your vision and your dentist, you would not verify their network in Florida Blue system.
Right.
So I didn't know if you were going to cover that later.
Yeah. So vision and dental, they are separate. Yes. And they have different. Yeah, we're going to go over that vendor list.
Okay. Thank you.
You're welcome. Vicki, I know you had something to ask or a comment, but your mic is very, very mute. It's hard to hear you. If you want to put it in the chat box, you could put it in the chat box.
Okay.
Okay, so that's provider searches for Florida Blue. We're going to get into one for Florida healthcare plans as well. So I'm going to exit out of this. We're going to do the vendors in just a little bit, like dental and vision. I thought that was one of our agents. Okay, so Florida healthcare plans is pretty much the same thing. Okay, so the link is going to bring you right to Florida Healthcare's Medicare resources and tools. And up at the top, we're going to click on Find a Provider. And then it allows us to narrow it down here as well. So if you have a certain provider that is provider that your member or a potential member is using, you can do a provider search right here at the top. So we can do, we'll see. Let me try Dr. Okay, Dr. Tuning, for example. When you type it in, the doctor's name usually populates. Sometimes it doesn't, you have to do a further search, but most of the time it does. And it will bring you right to a page where it has the provider's information. So as you see, it will have the contact details with the address, phone number, the provider details here in the middle with the provider ID, he's family medicine, the language he speaks, gender, additional information over here on the right-hand side. In the middle where it says provider networks, if you click on that, this will tell you whether or not he or she is accepting new patients. The PCP right here just says whether or not this is a primary care physician. If it shows N, most likely it's just because that's not a primary care, either like a specialist, or it depends on what you're looking for. So what's most important is whether or not this particular provider is accepting new patients. If not, you would see the an N here. Okay, and then locations here, it'll show locations. If there's more than one, it'll also show the additional locations here. So it's pretty easy for the most part. So if we want to search again, if we click on start new search, it's going to bring us back to that home page here for the provider. So if they don't have a particular provider that they use and they're searching, just like Florida Blues, we can type in the zip code. We can distance it out, or we can also search by county as well. It allows us to do that. If they're searching for a primary, it'll allow us to narrow it down by that. Specialist, again, telemedicine services, urgent care facilities. So there's all different ways that we can narrow what we're trying to look for as far as providers are concerned. Now we'll do specialist. So when we click on the particular radio button for whatever provider type we're searching for, we're going to click search providers. Now it's not until it brings us to this page that allows us to narrow it down even further. So to the right-hand side here, you'll see where it says start or advanced search. So we had chosen specialty. So now it's going to allow us to narrow it down even further by specialty type. So again, we can select cardiologist if we wanted, but it gives us all of these different options here. So we'll just do the same, cardiology. And then if we wanted to narrow it down even further by language, gender, whether or not they're accepting new patients. Again, make sure the zip code looks appropriate to where you are looking for vicinity-wise, and then click search. And then it's going to narrow it down to cardiologists within 20 miles of 32174 that are accepting new patients. Okay, so again, you can click on the actual provider. It will show you the details here. If you click on provider networks, and then it will bring you to this page here again, which here you'll see PCP. Again, it's a specialist, so that's where it changes it to an N. And then most important, accepts new patients. Yes. So it's pretty simple for the most part. So I definitely highly recommend navigating through this and getting familiar with the provider searches for both Florida Blue and Florida healthcare plans. Does anyone have any questions regarding Florida healthcare? Okay. All right, so it's pretty easy for the most part. Oops, where'd my page go? Okay, so we're going to get to the vendors here shortly. Formularies. So formularies are Very important, because this is what allows us to look up medications. So there's several different ways that we can access the formularies as well. So these are quick little links that are very, very helpful. So Florida Blue has a find a form link. Florida Healthcare Plans has their resource tool page. And then there's also a Medicare drug estimator tool, which is really, really cool because it allows you to input the actual drugs and it will automatically apply them to the plans. Okay, but we'll look at what the formulary looks like in whole first before we play around with this drug estimator tool. All right, so Florida Blue's quick and easy way to access Florida Blue's formularies, because the thing about Florida Blue is that they have several different Medicare Advantage plans to choose from, and they have 2 standalone prescription drug plans to choose from. Every formulary is different. So depending on the plan that you're choosing, it may have a different formulary than another plan. So we want to make sure that we're clicking on or choosing the appropriate formulary when we are doing research for our members on a particular Medicare Advantage plan or a standalone prescription drug plan. That's really, really important. So this tool I love, love, love. So if you click on it, it's going to bring you to this find a form tool. Okay, so you're going to have access to everything Florida Blue Rise pretty much at your fingertips. So if you're doing a Medicare Advantage plan, you would click on Medicare Advantage. If it's a standalone prescription drug plan, you would click on prescription drug plan. So we'll start with Medicare Advantage plans. All right, so from here, it's going to bring you to all the different Medicare Advantage plans that are available to our members, Florida Blue Wise, across the state of Florida. So depending on what plans that you're looking at with your member that are available in that particular county, you're going to click on the appropriate plan. So if we're clicking on Blue Medicare Premier because they're in South Florida, or they're in the Orlando area, or they're in the Jacksonville area, they're in different counties, just depends. Maybe they're looking at the Premier option. So we'll click on that. So then from here, it narrows it down even further, because not every Medicare Advantage Premier plan is the same in every county. So a lot of different plans, right? Kind of gets a little bit overwhelming, but this is a super helpful tool. So this from here will actually narrow it down and give you the summary benefits for all the different counties for the Premier plan for Florida Blue, the evidence of coverage for the Premier plan for Florida Blue, the annual notice of change, and then what we're going over right now is the comprehensive formulary for the Premier plan. So the Premier plan for Florida Blue, doesn't matter what county it is, the Premier plan has one formulary. So you're going to click on that formulary, and it's going to bring you straight to the formulary, which is really, really nice. Some formularies do have more than one plan on it, so it just all depends. But again, a quick and easy way to access those formularies is through that find a form by just clicking on the appropriate plan. So the formulary is several pages. It's 167, this particular one. So there is a lot to go through as far as a formulary is concerned. So the first few pages is just a lot of information regarding, what to expect, when going through the formulary, what this and that means. Everything is in alphabetical order as far as drugs are concerned in the back of the book. So it'll tell you the name of the drug in alphabetical order and what page number you can find it on. And then you'll also see different restrictions next to a particular drug. It may say PA, which stands for prior authorization, QL, which stands for quantity limits, ST, which stands for step therapy. So you can always reference back to that within the formulary if you're not sure exactly what those abbreviations mean. And then it also goes over, Q&As. What if my drug's not in the formulary? How do I request an exception? So these formularies are extremely helpful, especially because we always have those questions. What if a drug isn't in the formulary? What do they do? So you can always reference back to these Q&As. And then as you move forward, it'll also what's nice about the Medicare formularies is it will break down the tiers and the cost for the Medicare plan. So that's within the first few pages as well, which is really, really nice. So you can always reference back to that. So depending on, what drugs your member takes, there's a couple different ways to look. Again, you can page all the way back to the back. Let me get there. And everything's in alphabetical order, like I stated, with the page number next to it. So depending on what drug they're taking, you can look it up and find what page it is and go back and forth, if you will. A quick and easy way that I like to use, and I know a lot of other agents like to use, is either Control F or Command F on your computer, depending on what type of computer you do have. But if you click on that, this little box is going to populate up top, and you can quick and easily type in the drug. And then it will show the drug on however many pages that particular drug comes up. So you can quickly and easily scroll through each page to find that drug quickly. So I typed in lisinopril, for example. So I want to make sure I'm finding the appropriate lisinopril. So I'm going to scroll. So as you can see, it's going to bring me to every single lisinopril, and I'm looking for lisinopril 10 milligrams, which is right here. And then I'm going to scroll over and it's going to show me it's a tier 1 drug. Okay, so I would write that down on my checklist. And then the next drug I can do metformin. Sometimes if you don't know how to spell it, just start typing it in and it'll start to populate. If you're not 100% of the spelling, just in general, just Google it and you'll be able to find that spelling. So quickly scroll through until you find the appropriate metformin, and it's going to bring you to every page that has metformin on it. Just keep scrolling. And then here we go. So metformin, I'm looking for the metformin HCl tab 500 milligrams, and I'm going to scroll over and it's a tier 1. And this particular drug has a quantity limit of 150 tablets for 30 days. Okay, so we would want to make sure we write that down on our checklist as well. All right, and then I'll do one more drug. I'll do cephalexin. All right, so then it's going to quickly and easily bring me to cephalexin, just say right here, 250 milligrams, tier 1. And then I'm going to write that down. So it's pretty easy for the most part as far as looking up the prescription drugs on an actual formulary. It's just making sure that you're choosing the appropriate formulary for your plan when it comes to Florida Blue. Okay. So again, you just want to make sure that you're choosing the correct plan. So when you click on Medicare Advantage plan, you're going to select the appropriate plan. We'll do the value PPO right now for Florida Blue. So as you can see, there's several different counties that offer the value PPO, but we're going to scroll down to the formulary for the value PPO and click on it. And then same thing, the value PPO formulary is going to populate for us, and we would do the search just like we did previously. So either you can scroll to the back, you can click Command F, type it in. So cephalexin here is a tier 2, and then you can try to find your other drugs as well. So we'll do lisinopril, 10 milligrams, tier 6. And just like the other formulary, towards the beginning, it'll break down what the cost is for each of those tiers, which is really, really nice. And then remember, Florida Blue has 2 standalone drug plans. So if someone is not enrolling in a Medicare Advantage plan, because our Medicare Advantage plans are inclusive of prescription drugs, if they do not go that route, so say they decide they just want a standalone prescription drug plan or a supplement plan, those have their own formularies as well. So you would want to click on prescription drug plans, Part D, And then it will bring you to the Premier and the Complete, which are our standalone prescription drug plans. And you would click on one of those. And that will bring you here to where you have the formulary for the standalone complete prescription drug plan, and you would click on that. And then business as usual. So it will bring you to that formulary for the standalone prescription drug plan. So same search protocol. All right, so any questions regarding Florida Blues formulary through the Find a Form? Okay, while we're in the Find a Form, this again is a very, very helpful tool that we like to use because it always allows us to have access again at everything at our fingertips. So when you click on a particular Medicare Advantage plan or a standalone drug plan, just say, you're always going to have access to the summary of benefits. You're always going to have access to the evidence of coverage. If you're having an issue trying to figure out more detail about the plan, the evidence of coverage is going to break things down in detail. So for example, we're going to click on evidence of coverage for Miami-Dade's Premier plan. It's literally 275 pages. So if you are unsure about something, as far as benefits are concerned within a Medicare Advantage plan, I highly recommend going to the evidence of coverage because most likely you'll be able to find your answer here. It breaks down things in such detail about the plan. It's really, really great, especially when it comes to like dental in a plan, because I know a lot of agents have questions about dental. Because it's such a long, it's 275 pages, you can always narrow it down by doing the Command F again or Control F again and type in what you're searching for, like narrow it down by a word or whatnot, and it will bring you to everything that is related to that particular word that you're looking for. So just say dental. So we're trying to find the dental benefits within this particular plan, what exactly is covered. So if you type in dental, it's going to bring you to every page that has to do with dental, as you can see. So this is going to narrow it down even further because, as you know, in the summary of benefits, it doesn't go into depth. It's literally just a summary of benefits, but the evidence of coverage will break it down in depth. So as you can see, the Premier plan here, it shows you exactly what they're going to get, what their responsibility is going to be. It even has codes next to everything, which is really, really nice. So if you have a question regarding more benefit detail, go to the evidence of coverage first. So this is very, very helpful. I love the evidence of coverage. So the Premier plan is quite awesome, especially in Miami-Dade. Covers a lot of dental. Okay, so any questions regarding the evidence of coverage? And then the annual notice of change is just every year, if there's come the annual enrollment period, if someone is enrolled in it, they're going to get a notice of any changes that are taking place for the following year. And this just shows us as agents what those changes are going to be as well, and what that annual notice of change is going to look like. So that's really, really nice. And then you always have access for each plan. You'll have an enrollment form, which is an application we're not going to use because we do everything electronically through our agent point. You have the Medicare star rating for each particular plan, which is really, really nice. Low income subsidy. So for those people that qualify for extra help, you have this chart here that's going to help determine what their premium would be if they did qualify for extra help. So it just gives you some additional information in here, which is really, really nice. And then a prescription drug transition policy. So if they take certain prescription drugs, this kind of gives you an overview of what the policy covers as far as prescription drugs are concerned and their transition. So this is really, really nice. So you always have access to these forms. So if there's any Q&As or something that you're unsure of, the majority of the time you can find it here under the Find a Forms. And again, each plan for Florida Blue is under here as far as Medicare is concerned, which is quite awesome. Quite awesome. So I love this tool. I use it all the time. Now, as far as Florida healthcare is concerned, when you click on Florida healthcare, it just brings you directly to Florida healthcare's resource link. Okay, so when you click here, it's going to bring you right to Florida healthcare's resources and tools. And Florida Healthcare Plans has a lot of the same information that Florida Blue does, but it's through their own individual Medicare site. Okay, so we already did Find a Provider, which is here. Okay, so if you scroll here under Resources and Tools, you're going to see 2022 Medicare formulary. The nice thing about Florida Healthcare Plans is that all their Medicare Advantage plans have the same formulary, whereas Florida Blue, they have different formularies for their plans, okay? Whereas Florida Healthcare Plans has one formulary, which makes it easy peasy. All right, so you would just click on 2022 Medicare formulary, and it's the same thing. Okay, the same exact thing that we went over with Florida Blue, the same way to look it up. You can either scroll to the back and look it up by alphabetical order and page number next to, or you can do quick and easy Control F or Command F and look it up by drug name. That way, and then it will bring you to the page where each particular drug is. You would want to make sure that you find the appropriate drug dosage, the tier, and then if it's subject to, prior authorization, dispensing limits, all of that good stuff. RM just means it's available through retail mail order. Again, if you're unsure about the abbreviation, you can scroll to the beginning of the book and it will break it down for you. And then again, metformin, just make sure it's the right dosage, and then the tier, so on and so forth. So again, it's very simple, very similar to Florida Blues, but they only have one formulary, which is so nice. Okay, and then back to Florida Healthcare's resources and tools. They have their star rating here. If you click on this link, they have transition of care form here. So they have their preferred fitness directory. So Florida Healthcare Plans does not have silver sneakers as opposed to Florida Blue does. So Florida Blue has silver sneakers. Florida Healthcare Plans has their own preferred fitness options. So Florida Healthcare has over 80 different gyms within their network. If a member is trying to find a gym within the network, or if we are trying to find a gym for them within the network, they can join as many of them as they want for free. And this is what the directory looks like. It's a gym list. And it's going to show them the actual gyms within their counties that they can join with the information. So that gym list is super helpful. So you'll always have access to that, because there are members that often call and ask, what gym can I join? You can always email them email them this template or this PDF. And then there's also the provider directory in print format, but it's going to be hundreds of pages, but you can also email them this option as well, because we do get a lot of members that ask us for print versions of the provider directory, but because it's always being updated, Florida Blue no longer automatically, or Florida Healthcare and or Florida Blue doesn't send it out. But what's really nice, Florida Healthcare does have access to this at our fingertips. So if we wanted to email the Florida Healthcare provider directory out, we do have that option to send it out to our members. So you guys will have access, and it just kind of breaks it down, all the providers. And it also breaks it down by counties as well, which is really nice. Okay, and then here is where all the plan information is for all of the counties that Florida Healthcare Medicare Advantage plans are in. So as you know, Florida Healthcare plans is only available in Flagler, Volusia, Brevard, Seminole, and St. Johns counties. Okay, whereas Florida Blue is available in the entire state of Florida. So when you click on this drop down here, it's going to show you all the plans that Volusia and Flagler have to offer as far as Florida Healthcare Medicare Advantage plans. And then you will have access to your summary of benefits. You have the evidence of coverage as well, the annual notice of change, the low income subsidy premium table, and then the additional benefits, which is going to be the information as far as, you know, vendor information. That's your over the counter, your dental, your vision, that's inclusive of the plan if so. And then the enrollment form, which is going to be the application, but we're not going to enroll through there. It's through our agent point. So you're always going to have access to all of this at your fingertips always. Okay, any questions regarding that? I think I have a question in the chat box. Okay, so Volusia County is in the Florida Blue find a form. It just depends on what plan. So Volusia County offers the regional PPO, which is the choice plan, and the value PPO. I just didn't click on those two, but they're in there. All right, so that is that as far as like finding formularies and provider searches and a quick little resources as far as summary of benefits are concerned and stuff like that. Okay, so a really cool tool that I like to use as far as prescription drugs are concerned, and I know a lot of you use this as well, is the Medicare Drug Estimator tool. Okay, so this is going to take us right to that link. All right, so what's nice about this is when you type in the actual zip code, make sure if more than one county populates, you're selecting on the appropriate county. And you're going to click on View Plans. And it's going to bring you to all of the plans that are available to our members, Florida Healthcare and Florida Blue wise. Of course, if you're in just a Florida Blue county, only Florida Blue plans are going to populate. If you're in a county that offers both Florida Blue and Florida Healthcare plans, both Florida Blue and Florida Healthcare plans are going to populate. So as you can see in Volusia County, we have Florida Blue's Blue Medicare Value PPO. We have Florida Healthcare's Premier Advantage, their Medicare RX, Florida Healthcare's Medicare RX Savings, Florida Healthcare's RX Plus, and then Florida Blue's Choice Regional PPO. So there's several different options to choose from. Now, to narrow it down even further, it allows you to add prescriptions, which will automatically be applied to each of these plans, whether or not they're covered, what their costs are going to be, the tier level they fall under, which is really, really nice and helpful, especially when it comes to breaking down costs and whether or not they're going to hit that donut hole during the year. So if we click on the left-hand side, add preferences, it's going to bring us to this page here. And then on the left-hand side, if you click on prescriptions, it's going to bring us to this page here where it will allow us to input their prescriptions that they take. So as you start typing in the actual prescription's name, it'll automatically populate. Again, if you don't know the spelling, just Google it and then click on the drug. Make sure you're choosing the appropriate dosage and then the quantity and frequency. And you're going to click add. And then if they have more than one, you're going to add those as well. So you're going to click on make sure you're clicking on the appropriate one, the quantity and frequency, add, and keep going. I'm going to just throw a few of them in there. Hydrochlorothiazide, the appropriate dosage, quantity and frequency, add, and then we'll do one more. Add. Now we're going to continue. Once we have all the drugs on the list here, we're going to click continue. When it gets to the next page, it's going to allow us to choose a pharmacy. Sometimes it'll show no pharmacy results. If that happens for some reason, just delete the zip code and type in another zip code that's close by. I don't know. Sometimes there's just a glitch in the system. I'm not sure why it does that. And all the pharmacies will come up within that region. So just scroll through and pick a pharmacy. I'm going to click a Florida Healthcare Plan pharmacy. I'm going to add, and it's going to show up here. And then I'm going to continue. Now, all of those drugs that I input are going to automatically be applied to all of the plans that are available to this member in the county. So as you can see, it'll narrow it down, and it usually puts it in order of which plan is going to be the most beneficial for them cost wise. It's going to be their lesser out of cost. Okay, so you can see here, it says all 4 of the prescriptions are covered under the Florida Healthcare Premier Advantage. The estimated drug cost for the year is $50. Total estimated cost, when you see that, that's just meaning they're just giving you like the average person of using medical services throughout the year. You can't really go by that number. That's just what they're thinking the average person is going to cost as far as total using drugs and medical services. So it just depends on your person. But estimated drug cost for this particular plan based on those drugs that we input is $50. And then scrolling down, the Florida Blues Value PPO plan, all 4 drugs are covered with an estimated drug cost of $80. Florida Healthcare's Medicare RX plan, all 4 with an estimated drug cost of $60, and then so on and so forth. So as you can see, the cost here. Sometimes, depending on the plan, some of the plans do have a premium, as you'll see here. So even though the drug cost is cheaper, just say on the Florida Healthcare Medicare RX Plus plan, it's $20. And Florida Blues regional PPO, it's $0. Those 2 come with a premium monthly. So you want to make sure, if you enroll them in one of those, cost wise, is it going to be more beneficial to them or whatnot? But the Premier Advantage looks like this one's going to be their best bet. So if you click on plan details, it's going to bring you to the details even further. So it kind of breaks it down. It gives you a quick overview as far as the benefits are concerned within this drug estimator tool, which is really, really nice as well. So you will have access to those benefits. And then when you scroll down towards the bottom as well, you'll have access to the star rating, enrollment application. Just skip right over that again, because we're doing all of our enrollments through the Florida Blue, our agent point. But you'll have the summary of benefits, the multi-language insert, the evidence of coverage as well. It'll also bring you to the provider directory. It'll also bring you to the actual formulary. So there's just so many ways to get to so many different things. Does somebody have a question? Oops.
I do.
What's that?
My question is, okay, so I noticed that you picked Florida Healthcare Pharmacy.
Mm-hmm.
So some plans have preferred pharmacies, and I did notice that it did state on that previous page before you click to this one that which one was in-network preferred and which one was standard. Mm-hmm. So
where are you talking?
Go see right here in the blue that little green or blue section right there where it says prescriptions covered and it says pharmacy, Florida Healthcare.
Yes.
plan pharmacy. That's
Yep.
the one you selected when you chose pharmacy. So they all got the same pharmacy. But if you were to look at the value plan, which is Florida Blue, are they allowed to use the Florida Healthcare Plan pharmacy? Is that what that means?
Yes, if they use Florida Health, if Florida Blue uses Florida Healthcare Plan Pharmacy, they're gonna get the standard cost of drugs, which is not gonna be the preferred cost of drugs.
Okay.
So if you use a preferred pharmacy, as far as Florida Blue is concerned, the drugs may be a little bit different as far as price, so they may be cheaper.
Okay. All
Yeah.
right. So I was just wondering if that, really mattered. I was trying to see how it made a difference. Okay. Thank you.
You're welcome. Yeah, it'll narrow it down whether or not, and that's a good question, whether it's a preferred or a standard pharmacy. So if I chose Walgreens, for example, you would see under Florida healthcare plans that Walgreens would be a standard in network, and that drug cost for Walgreens would be different.
The reason I asked that question because I always encourage members to use preferred so they have the lowest drug costs. So that's the reason why I was asking that question about choosing a different pharmacy. So I always try to choose the one that's in the book or one of the ones that's in the book.
Yeah, if you're doing Florida Blue, I definitely recommend using one of Florida Blue's in-network pharmacies. Florida Healthcare, obviously, we want to use Florida Healthcare's in-network pharmacy, which is Florida Healthcare plans.
Now, they're not allowed to use the Florida Blue ones, are they, for the Florida healthcare plans?
Say that again?
Are the Florida healthcare plans allowed to use the Florida Blue pharmacy networks?
Well, we have access to Walgreens and stuff, but it's going to cost, it's a standard.
Okay.
It's not going to be as cheap as if we are to use Florida healthcare plans.
Okay. All right. Thank you.
Hey, Jamie.
Yes.
This is probably a silly question, but it's just because I don't understand the drug plans
Silly
really well yet. What's the estimated drug cost versus the total estimated? At the bottom here, the blue.
Where are we?
Under prescriptions, and then it says pharmacy, and then it says estimated, just where you were a minute ago, down there where you were showing.
Let me go back. Hold on. Are you talking about right here where it says estimated?
Yes.
Right where it says total estimated?
Yeah, yes.
All right, so estimated drug cost just means what the cost is going to be for the actual drugs on this plan based on that pharmacy. The total estimated cost is literally everything all inclusive what that plan thinks the average person is going to use. So if the plan were to come with the premium, that would be included. The top cost of the drugs is included, and then just the cost of them using medical services throughout the year. That's just a general cost that the plan automatically applies, thinking what the average person is going to use. If you scroll down here, just say to the Medicare RX Plus plan, they're including what the monthly premium would be within this total cost. So $35 times 12, the estimated drug cost, and then also just again, the average person of what they would use medically wise throughout the year by going to the doctor's office, copay wise, and stuff like that.
Oh, okay. So your total estimated cost is your monthly premium plus your estimated drug costs of all the drugs.
Yeah, for the year. Yeah.
Okay.
They're kind of,
Okay.
yeah, it's just a total estimated cost. They're giving like the average person on that particular plan on.
That's what I thought, but I wasn't sure. Okay, thank you.
You're welcome. So if you go back to plan details. All right, so again, it will break it down. So if you click on prescriptions, it'll break down what tier level the prescriptions will fall under. Unfortunately, one thing that this does not do is give you the number of the tier. So you would have to reference back to, the summary of benefits as what tier preferred generic is, which would be a tier 1. A generic would be a tier 2. So that's the only thing that it does not break it down as far as like 1, 2, 3, 4, 5, but it does give you which tier it is. So hydrochlorothiazide, lisinopril, metformin are all a tier, preferred generic tier. Generic is cephalexin. And then you've got preferred, non-preferred, and specialty tiers. And then your non-covered prescriptions would show here, but all of these are preferred, generic, and generic. And then it also breaks it down even further, whether or not it's subject to prior authorization, quantity limits, step therapy, and it looks like none of these are, but it would show whether or not they are. And then it also shows what the retail cost of the drugs would be, what it would be before the gap, during the gap, after the gap. But to break it down, if you click on total costs, now this is going to break down everything month by month, which is really, really nice, okay? So for example, it's going to show hydrochlorothiazide is going to cost $0. Lisinopril is going to be $0. Metformin is going to be $0. Cephalexin is going to be $5. You can see the estimated cost Connie is showing here. So for example, this is what they think the average person is going to spend monthly on their health costs is $61.71. But they might spend more, they might spend less. It just depends on the particular person. But drug cost for this particular person is going to cost $5 a month because 3 of these drugs are $0 and the 4th is $5. And then we can break it down again month by month. So it's going to show that breakdown of all the prescription drugs, which is really, really nice. Now, if somebody were to hit the donut hole or that coverage gap stage, it's going to show you what month they're going to hit it in and what their cost is going to go to. So that is really, really nice. You can save it as a PDF so that you have it. I do that for a lot of my Medicare members, especially when they take a lot of drugs and I know that they are going to hit that donut hole. So you'll be able to, I mean, most people never hit that donut hole, but you do have some people that take a lot of prescription drugs and, or they take a lot of drugs or maybe 1 or 2 drugs that are very, very expensive. So it's going to allow them to hit that donut hole, unfortunately. But this is an awesome tool. This will show you the breakdown. Does anyone have any questions? Has anyone used this tool?
No, I've never used it, and I didn't see how you got to that screen. Did you click? What did you click on the previous page to get there?
So I have it on my cheat sheet that I'm going to send out.
Okay. No,
And-
not that when you was on that screen. You clicked to go somewhere, didn't you? Like previous, where were you
Oh,
before?
total cost, total cost.
Not this screen, the one, this whole screen. So click, what did you click from?
I'm going to go back. Hold on.
Okay.
Are you talking about when we get to the plans?
Yeah, when you were in here, how did you get to the screen we just came out of?
Okay, so you're going to go to plan details.
Okay. I'm sorry, I missed it.
No,
I
no,
was
no,
responding to a text message, sorry.
Fine. And then you're going to click on total costs.
Okay, gotcha.
And then
Thank
it's
you.
going to break you down from there. Again, guys, do not click on this enroll. This is just for us to look up plans and prescription drug breakdown costs. And then we do all of our enrollments through Agent Point, okay? And then if we want to add, you know, prescription drugs or we need to edit the pharmacy, it allows us to do so. We can click on this add edit button to the right-hand side, but that it also allows us to, if we go back to previous, if we go back to previous, it'll allow us to edit as well. So on the left-hand side, you would just click on edit for prescriptions and pharmacy as well. Okay. All right. So that's a quick and easy tool as far as drug estimator cost is concerned. Does anyone have any more questions or want me to go through anything else as far as how to look those up? Okay. All right. So moving forward. All right, so let's go back to the next. All right, so scope of appointment and enrollment checklist. Now that we've looked up drugs and
Excuse me, Jamie.
yes.
I think there's a question in the check box about diabetic medication costs.
All right,
I just thought maybe you want to cover that before you go to scope.
let me see. What is the total cost versus estimated drug cost? Can you talk about diabetic medication costs? So I mean, I guess it just depends on diabetic medication costs. I do have an overview. Let me see if I can pull it up. I'm going to get to the diabetic in a minute. I'm going to be logging into the site that has a breakdown of like diabetic costs and stuff like that. But it also depends on diabetic medication costs. Some are going to be covered under our prescription drug, and some, depending on how they're administered, are going to be subject to Medicare Part B. So it just all depends on what particular diabetic prescription or diabetic drugs they're taking. So what do you want? What would you like me to elaborate on as far as diabetic prescriptions are concerned about? Type that into the chat box. Because when it comes to diabetic prescriptions, again, like I said, it just depends on the administration. Some are subject to B versus D.
And also, Jamie, while you're waiting on her to type that in, I just wanted to say that, as you do this more and more, you have different experiences, so you learn different things. And what I noticed with diabetic supplies, some doctors will tell your member that, will tell your client that whatever they're trying to get for them, they're not in network. For example, like that Freestyle Libre sensor. You know what I'm talking about? That it's a diabetic thing that people put on their arm and can just use a little electronic device, I guess, to scan their results in.
Mm-hmm.
So like I had a client whose doctor told them that wasn't covered and they weren't in network. And I found out that through the vendor CareCentrix, it is covered and they don't have a copay. All they have to do is call and order it. So they told me at CareCentric all their diabetic. Now it could be different, like you said, depending on what kind of diabetic item it is. But they told me that all their diabetic supplies should be covered with the exception of insulin without a prescription through CareCentric, and they can just call and order it there. But I had to find out because so you want to be careful with some providers who are telling misinformation to clients because they don't know the process under the plan. So just anytime someone calls you, don't always take what their doctor is telling them as so. Find out for yourself just to make sure so you give your clients the best service.
Exactly. Now, as far as diabetic supplies are concerned, like Robin was saying, yes, a lot of our diabetic supplies are 0% because it's durable medical equipment, 0%. Some plans it's 20%. It just depends on the actual supplies. But like Robin was saying, a lot of the times it is 0 cost. But as far as like prescription drugs are concerned, as far as diabetic drugs, again, it depends on whether it's going to be subject to B versus D. So I had someone, for example, a couple weeks ago, and she took a concentrated Humulin diabetic medication. She's on an ACA, she was on an ACA plan, and it covered 100% of it. Pretty much. I mean, I think she paid like a $20 copay, but once she goes on to Medicare, because it's administered through a pump, she's going to be subject to B, it being billed under her Part B, where she's going to be subject to 20%, which her cost is going to be like $1,000 a month from like $20 a month. So it just, again, all depends on, the actual diabetic medication, whether it's going to be subject to B or D. A lot of diabetic medications are covered 100% at a 0 cost. Vicki, I think, thank you. Diabetic meds can be 0 cost in some companies. There are diabetic meds that are 0 cost, but again, it just depends on the actual medication. But as far as diabetic supplies, that's different because that's different than the medication. Supplies are different because that's categorized as durable medical equipment. But like Robin was saying, yes, durable medical equipment a lot of the times is covered 100%. And again, depending on the plan, they could pay up to 20% for diabetic supplies as well. And it just depends on what it is. So what was that, Robin?
I'm sorry. I don't want to keep interrupting your training. I just want to say something I felt was really important about the diabetic or any drugs in any situation. If you call the pharmacy vendor, Prime, what is it called? Prime Therapeutics, and give the member number, you can ask questions about drugs for your member and ask them, how is it covered or what's the copay, or like I heard you say something about something was $1,000. Because I found out for one of my clients that there is a vendor who is a foundation. There's a foundation that covers some of the insulins if they qualify. So I was able to get one of my clients in that foundation, and the income it goes by your income and how many people in the household, which like his income was only in the 30,000s, but he was able to have as much as 50, over 50. So they sent him that insulin directly because he was in the coverage gap and he had to pay the 25%. So it made his copay go up to over $200, which he couldn't afford. So a month, or per prescription, excuse me. So I was able to get him in that foundation. I helped him do everything, fill out the paperwork, had his doctor fill out the paperwork. So sometimes if you call the vendor, they can tell you ways to help your client. And then, once you learn to help one, you know how to help the rest. So that was just something that I wanted to just share in case other people didn't do
No,
that.
you're absolutely right, Robin. Because that particular client that I'm enrolling into the Medicare plan,
Mhm.
we were able to get like a grant for her that through a foundation.
Awesome.
And the reason how we found out through that was about that, I should say, is through Florida Healthcare's pharmacy. They were working with us because she has an actual case manager through Florida Healthcare plans. And when we were transitioning her into the Medicare Advantage plan, we weren't 100% sure of how that particular drug was going to transition over because she was going obviously from a $20 drug at that time to over $1,000. So the pharmacist with Florida Healthcare plans had recommended the foundation, in which she ended up being eligible for a grant that's going to cover the entire thing.
Right.
So it's pretty awesome.
Yeah, and because you can't use coupons
I was just gonna say that.
on the Medicare plans. The government plans will not allow you to process like a GoodRx coupon with government plans. You can on our healthcare plans. So, but when you get to Medicare, it's totally different. So I just wanted to state that too. And that's why it's good to ask questions to the pharmacy vendor because they'll have a lot of answers that we don't know. So
yeah, and even so through the actual manufacturer itself that offers coupons, once they become Medicare eligible, it's the craziest thing. You can't use those coupons any longer.
right.
So it's just so unfortunate. So a lot of people, they need that extra help out there because a lot of these medications, when they're, ACA or whatnot, and they're paying next to nothing for their drugs, and then all of a sudden come Medicare and now their drugs are going to skyrocket. A lot of times we can, find them help and whatnot, but yes, reach out to the vendor, reach out to the pharmacy. A lot of times, they know something that we don't, and they can recommend and help us, so don't be afraid to ask. Do not be afraid to ask. Okay. All right. So next things next. So we are going to go to the Florida Blue site. If I can type. And we are going to log into our agent point. Right, so all of that information that we just went over, again, the formulary, drug lookup, the provider lookup, we need to input that information on the enrollment checklist, right? And then we also need to get those scope of appointments. So there's several different ways to access, the forms and stuff like that. We always have them in our enrollment booklets that are in office. So you'll always have access to those if you get to one of our offices and pick up some of those enrollment booklets. But if you need one because you're doing something over, online and you don't have access, or you need to print one out, you'll always have the option to do that as well. So for Florida Blues scope of appointment, the easiest way, and it used to be in here and it's not, but you'll have to save it, is at the beginning of the actual application. You can print it or you can email it to them electronically for e-sign. Okay, so unfortunately, it does not allow us to look up the scope of appointment here, and it's not in the Medicare toolkit any longer either. But if you click on Education tab on the left-hand side, it's going to bring us to this page where we can click on Toolkits. And then in the toolkit here, you're going to see Medicare Agent Toolkit. And the Medicare Agent Toolkit is so awesome because we pretty much have access to most things that we need as far as Medicare is concerned. So anything that you need Medicare wise, whether it's, information you need about compliance, Medicare Advantage materials, supplement materials, formularies, there's presentations, you're going to find it under your Medicare toolkit. They do have the enrollment checklist, which is what we really need. You can either find that again in the actual application when you're doing an enrollment, it's towards the end. You can send it electronically for their e-sign, or you can find it here in the toolkit. So you can either scroll and try to find it, or you can click on Control F and type in checklist, and it will bring you to all of the enrollment checklist. And there's both Florida Healthcare and Florida Blue in here. So it's going to bring you to all of the checklists for all of the different plans. Okay, so you would just want to make sure that you click on the actual checklist. Well, that's loading. This is what a checklist looks like, okay? It's very simple to fill out. You're gonna put your applicant's last name, first name. And then these are the Q&As that we were discussing. So these are questions that you need to ask your members so you know that understand that they've applied for Medicare Advantage plan. They must have A and B, continue to pay their Part B premium, all of that stuff. So I always tell my member, I'm going to ask you these questions, or you can go through these questions. We want yeses. So if there's something that I missed, because we're only human, or there's something that you don't understand and you need me to go back over it with you, please let me know, because we want to make sure that we get yeses on all of them. Okay, now, when you're going through this checklist, if you're just strictly doing Medicare Advantage plans, you would do these first 3 boxes, and then you can skip over this Part D prescription drug plan. And then this here is for all plans, whether it's standalone prescription or Medicare Advantage. If it's just a standalone prescription drug plan, you would just do the Part D prescription drug plan, and then where it says for all plans. So just depending on what you're doing. And then if you scroll to the next page, this is where you're going to input your drug name. And again, you can print this out, save it as a PDF, whatever you want to do with it, but you always have access to it. So when you're looking up prescription drugs, this is where you're going to put the drug name along with the dosage. So just say if it's 20 milligrams, and then if you want to put how the quantity and limit that they take. So if they take 30 a month, you can put that there. Whether or not it's covered, the tier, so if it's at tier 1, and then the cost. So depending on what plan you're enrolling them in, it fits the Medicare Premier Advantage plan. Tier 1 would be a 0 cost, so put 0. If it's B versus D, which will tell you in the actual formulary, whether it's B versus D, you want to make sure you select that, whether it requires prior authorization, quantity limits, step therapy, which again, it tells you when you're doing that drug search. So that's where all of the drugs would go here. If for some reason you have somebody that takes numerous drugs that are more than what allows here, you can add them. I just add them to wherever I can, like whether it's right here below, or some agents get another sheet of paper and add onto that and just make sure they sign the additional sheet of paper. But it just depends on the actual agent and how you want to do it if they have more than what this space allows for. Here's more additional questions when it comes to the Medicare Advantage plan. So make sure yes answers on that. And then here's where your providers go as well. So the provider search that we did, you're going to put the provider's name, whether or not they're participating. So PAR means participating, NON means non-participating. So that means they do not participate. And then the provider's complete address. Again, if you need more room than what's allowed here, you can add below or add to another sheet, whatever your particular preference is. Okay, so that's really, really important to make sure that you are filling out this enrollment checklist. And then last but not least, this page here is the acknowledgement that we've reviewed all the doctors, hospitals, prescription drugs that they've provided today, and that we've discussed each provider's participating status within the plan, as well as their cost share and any requirements or limits regarding the drugs. They understand that some network providers may be added or removed from the network at any time. For additional providers or get the most up-to-date information about the plan's network, they can call the information here. Florida Healthcare, you know, theirs looks pretty similar. Florida Blues, this is Florida Blues. Their name and date goes here. Ours as the agent goes here along with the date. So this is really, really important. You can make a copy for your member and give, but you want to make sure you always keep this filed away in case, you know, it's ever requested in the future. Okay, and then Florida Healthcare Plans has their own enrollment checklist as well. So if you scroll down here, you can click on Florida Healthcare's. And then you can access Florida Healthcare's enrollment checklist as well at the end of an application when you're doing it electronically. You can send for e-sign. Whoops, I clicked on the Spanish version. Okay, let's see. All right, so these are just kind of Q&As. Make sure you do let your member know that every year during October 15th and December 7th is the annual enrollment period. So at that time, they can make any plan changes if they will, but if they're happy with their plan, it will automatically be rolled over. And then this is their, oh, I clicked on the wrong form, I'm sorry. Where's their checklist? Did they delete it? They sure, oh no, here it is. It's about to freak out. Okay. But yes, do make sure you mentioned the annual enrollment period for Medicare, October 15th to December 7th. That's really, really important. That's one of the questions on the enrollment checklist towards the end, that they are aware of that. So theirs is the same, Florida Healthcare Plans, the same, last, first. And then you want to answer those questions, yes, no. And then move to where we would input the drug name, same steps, provider's name, participating or not, address, the acknowledgement, their signature, our signature, and date. So it's pretty easy for the most part. Just make sure you are getting that filled out. It's very, very important. Any questions regarding that? Okay, so as far as the scope of appointment is concerned, Florida Blue, unfortunately, we can't access it from here. Florida Healthcare we can only access Florida Blues at the beginning of the actual application. And same with Florida Healthcare, we have access to it at the beginning of the application as well. But Florida Healthcare Plans also has an alternative way to access the scope of appointment, and that's through their Medicare resource tool that we were at earlier. Let me get to that. My computer is running slow, I apologize. Right, I'm gonna do it this way, okay. This is, actually, I'm gonna bring you to this. This is a Florida Healthcare's broker site, which has a link in my cheat sheet here, which is gonna bring you right to this page where you can access the scope of appointment enrollment checklist as well. So under sales collateral here, you'll have access to, again, a lot of important information. You have transition to care, extended care hours center. Here's where you're going to find your scope of appointment enrollment verification checklist that we just accessed through the toolkit, but you also have access to it here. And then you also have plan documents. So you'll have your summary of benefits here, provider directory and formulary links. So there's so many different ways to access things. It just depends on what you're comfortable with. And then this is, again, on my cheat sheet, this link. But the scope of appointment, what it's going to look like, it's going to look like this. And it's very similar for both Florida Blue and Florida Healthcare Plans. This is actually a writable form, if you will. So you would type your name as the agent, and the Florida Blues actually looks reversed. So it has this page first. And then this page is last, but the writable version has the agent's information first, but they're all the same information. So our name is going to go here, agent name, agent phone number, our beneficiary's name, which is our member that we're enrolling, first and last name. And then optional, you don't have to put, but you can put their address and their phone number here and the date the appointment was completed and the plan that we represented. So if it was the Florida Blue Value PPO plan, we would put Florida Blue Value PPO plan. We don't need to put anything in plan use only. The initial method of contact, you do need to put whether it's a walk-in. I do, if it's an inbound call, I'll put inbound call, even though we technically don't need a scope for an inbound call if they're calling off of like an advertisement or something, but I try to always get a scope of appointment for everybody. Agent signatures, where our signature is going to go here. Now scrolling, their signature is going to go where it says beneficiary authorized representative. So signature here, date here. If they are authorized representatives, so signing on behalf of someone, if they're a POA, like a power of attorney or something like that, if they will sign there, they need to put their information here and what the relationship is. Scrolling, if we were doing a standalone prescription drug plan, we would want to mark this box and they would initial here. If it's a Medicare Advantage plan that we're enrolling them in, we would X this box and they would initial here. And again, this just allows us to speak to them about Medicare Advantage or standalone prescription drug plans. Okay. This, I mean, is an additional form. Says was signed by the beneficiary at time of appointment, provide a written explanation below why a scope appointment was not documented prior to meeting. So just say that it was a walk-in. You would just put, you know, it was a walk-in or an inbound call or something like that. I know. So you always have access to that scope of appointment. And again, they're also going to be in your enrollment kits that we have in the office. So both scope of appointments and enrollment checklists are going to be in your enrollment kits that we have on hand in all the offices. But if you need access to it online, you can access them online as well. With Florida healthcare plans, you can do so through this link here, through the broker site. With Florida Blue and Florida healthcare plans, we have access through our agent point when we're actually doing the application. So it just depends on what you're comfortable with as an agent. So let me log back in. I got kicked out of agent point. All right. Does anyone have any questions regarding that? What's most important is getting those forms filled out just so you have them on hand.
Now, I'm trying to give somebody else a chance to say something before
I love that you're talking, so go.
before I say something else. I was just going to say about the scope of appointment. I mean, I don't understand why they need us to have them sign it before the appointment, because most people are going to look at you crazy like, what do you want me to sign? You know what I mean? And you're trying to get an appointment to get in their house and you want them to sign something already. You know, sometimes that's uncomfortable for some people. So I don't understand why they need us to get that ahead of time.
I know and I know it's really difficult for us to even, meet them ahead of time and stuff like that. What's most important is just getting it signed. If it's at the time of appointment, just write down on the form, why you couldn't get it signed ahead of time, unable to meet or whatever it is, just so you have that noted. You know what I mean? So.
All right. I was just making a comment. That's all.
Hey, Jamie.
Yes.
I don't know if this will help or not, but I was told this a couple of years ago that the easiest way to get around that is just to tell them that by law, this gives me permission to talk to you about this, this plan.
Well, I think she means like when you make an appointment with somebody, just say to go to their house and like sit down, and you can't get that scope of appointment signed before you.
Okay. Yeah.
Yeah. Sometimes it is difficult.
Yeah. Okay.
To do that. Okay. So now also one thing that we need to go over with our members is the star rating to let our members, our clients know the rating of each plan. Okay, so we can find that again in our Medicare agent toolkits. They're also in our enrollment booklets as well. In the office, we have them, but you'll always have access to them within your toolkit. So if you click on Medicare agent toolkit, and I have it on the cheat sheet, so while that's downloading, you'll have access to your star ratings that we went over earlier in the find a form link. So I just have this cheat sheet showing you how to access it. So the star rating for Florida Blue is in your find a form. So when you go to the find a form, you click on Medicare Advantage, it'll have the actual star ratings for each plan. And then we can also find those star ratings in the Medicare tool link that we're going into toolkit. And then for Florida healthcare plans, we can go to their resource page as well as the Medicare toolkit. So this cheat sheet is highly useful. All right, so within the Medicare toolkit, again, we can scroll through or we can just type in what we're looking for, and then we'll come to the star ratings. So when you click on the actual star ratings, you want to make sure you're finding the appropriate plan. And this is what a star rating looks like. So this is the overall star rating for the Florida Blue H1035 plan, which I'm pretty sure is the premier plan. I can't remember off the top of my head. So overall is a 4.5 star, same with health and drug overall star rating. And what it does, it rates the plan on their health and drug services, feedback from members about the service and care provided by the plan, the number of members who left or stayed with the plan, the number of complaints Medicare got about the plan, and data from doctors and hospitals. So 4.5 is pretty darn good. We were 5 in the past. Hopefully we'll get there again soon. When we do have 5 stars, that means it allows us to enroll throughout the entire year. We don't have to wait for the annual enrollment period. So that's a really, really nice benefit to being a 5-star rated carrier. So let's strive for that again. Hopefully we get that here in the future again. We were so close to getting that again. I do have a chat. It's a requirement that we have to give them or tell them the star rating now. It has been. So there was a question in the chat box that said, I was told a long time ago, avoid star ratings unless customer asks. So we put a star rating in all of our summary of benefits. It has to be in there, and we just need to mention it. It's CMS guidelines, so that's just what it is. Can you resend the cheat sheet so I can save them with my notes? Yes, I'm going to resend this cheat sheet right after training. So that's what the star rating looks like. Again, Florida Blue, and then Florida Healthcare has their own star ratings as well. All right, so vendor, yes, to everybody. I'm sending it to everybody, the entire agency, even those that couldn't join the training this morning. All
From
right.
my experience, I really don't think people care about the star rating. As long as you're giving them a good plan and you're giving them great service, I don't think people care about that.
You are right. We give them the best service.
You sure do. Top notch, white glove on my end. I don't know about anybody else.
That is true. All right, so vendor directory. So our Medicare Advantage plans, a lot of them come with additional benefits like vision, dental, over the counter, all of that good stuff. I've sent this out in the past, but you'll always have access to it within your Medicare toolkit. So if you either scroll through or do a quick search through your Command or Control F, you can click on vendor directory. And this kind of breaks down the vendors, which is really nice. So at home care, behavioral health, caregiver support, care site, dental, diabetic supplies, digital health, education, drug lookup, so on and so forth. So, and it gives you, if there is a link for the actual website, it'll actually give you the link for that as well. So this is really, really helpful. So at home care, PAPA, behavioral health, caregiver support, Pop Healthcare, dental, Florida Combined Life. So for our dental, for example, our plans that include dental, if we go to this particular link here, which is floridabluedental.com. This down here. This is where we would do our dental search. All right, so at the very top where it says find a dentist, we are going to select plan name. If you scroll down to where it says Florida Blue Medicare plans right here and Florida Healthcare plans, this is for Medicare that we're looking up. Towards the top for individual non-Medicare, we would choose Blue Dental Choice or Blue Dental Choice copayment. Those are our standalone dental plans, Blue Dental Choice copayment. But we're just strictly looking up for our Florida Blue and Florida Healthcare Medicare Advantage plans that include dental. So you would make sure you click on the appropriate Medicare Advantage plan. So if it's Florida Blue, you're going to click on the appropriate Florida Blue Medicare Advantage plan. If it's Florida Healthcare plans, you're going to scroll down and click on the appropriate Florida Healthcare, Medicare Premier Advantage, Medicare Flagler Advantage, Medicare Premier Plus, Medicare Valor, and then same with Florida Blue Medicare Classic, Premier, Premier Plus, and so on and so forth. So we'll click on Florida Blue Medicare Value PPO. If we're looking within a certain vicinity, of course, we can narrow it down and then we can type in.
Hey, Jamie.
Hey, yes.
I'm sorry, I had to take a phone call. So I missed where you where did you go to find a dentist? You're just on the Florida Blue at the homepage. I missed that
So
part.
if you're in your toolkit and you click on the vendor directory, it's going to bring you to the vendor directory, which I've sent it out an email. I'll send it out again along with the cheat sheet. But in here, it has the actual site for.
Oh, okay. Is that the only place that you can pull that up? You can't pull it up under the provider list?
Well, you go
under
to Florida,
specialty?
you go to floridabluedental.com.
Okay, okay.
Yeah, it's floridabluedental.com, but this is a quick and easy way to get there. And you can bookmark this tab as well. I highly recommend bookmarking any tabs that you're gonna find useful in your bookmark so that you'll have quick and easy access. So if you look at my bookmarks, if I click on bookmarks at the top, you'll see I have access to pretty much everything. I bookmark everything that's gonna help me along the way. So
Okay.
anyway, so you're going to, again, drop down, you're going to scroll down to the Medicare plans and you're going to choose the appropriate Medicare plan. And then you can narrow it down. So if you're doing zip code, county, so on and so forth, the vicinity. If there's a certain dentist you have in mind, you can type that in and do a search. But if you're just doing a general search, you can click search. And it's going to bring up all the dentists that participate with that particular plan here. So there's quite a few, as you can see. Now you can narrow it down even further to the right where it says all specialties. If you're looking for a general dentist, you can click on general dentist. If you're looking for an oral surgeon, you can click on oral surgeon, orthodontist, orthodontist. So just depending on what you're looking at. So we're going to click on general dentist. And then it's going to narrow it down to all the general dentists that are participating. Again, you can go one step further for your member and just call the dentist and make sure that they are participating. But this is how you are going to access the dental directory for our standalone dental plans and our Medicare Advantage plans that include dental. All right. And then if you keep going, yes.
I'm sorry. I just want to add one more comment. For our dental plans, even though they're through Florida Combined Life, our dental company, and they're all PPOs, because even on the HMO Medicare plan, the dental is still a PPO. However, under the Medicare plan, you can't go out of network at all. So sometimes when calling dentist office, you want to encourage your client to ask if they're, well, you're going to give them a list and they'll know they're in network, but for sometimes they don't. So you want to ask the question if they're in network, not that they take the plan, because if they just tell the member they take the plan because they know it's a PPO under Florida Combined Life, they'll wait till they get the member in the chair, do the service, and then they'll tell them they owe a bill, or they'll send them a bill later without telling them at that moment. So you want to always make sure the member is asking, are you in network? And that's why you want to give them the dentists that are in network. It happens all the time. So I'm just saying.
And also I found, this is Sony, I also found that when you call the dentist office, when you tell them it's a Blue Dental co-payment plan, they automatically think it's a HMO plan, but we do have to let them know that it is a one, we have two PPO plan, and the co-payment plan is our PPO plan as well.
Yes, I don't know. Do we even have an HMO dental plan at all? I think we only have PPO, right?
We do.
Standalone, our standalone one, the one that's $11.99.
Oh, okay. I don't ever do those. I just need to do the choice of the co-payment.
Now, one thing that I will say is that if you guys are coming across any members that are having issues with providers as far as dental providers are concerned within their Medicare Advantage plan, so if they are calling and the dental provider is saying that we don't take it, please let me know, because Brandon Bureau, our Medicare area manager, had reached out to me yesterday to ask me if I've had any feedback or any calls from agents regarding that within the last week or so, and I told him I have not. So if you guys come across any issues, let me know, and I need the name of the actual provider so that they can get to the bottom of it. because there's a lot of providers that just don't understand, how to move forward and how it works.
So
Well, I
Jamie,
think,
I'm sorry, go ahead.
no, go ahead, Connie, I'm sorry.
I'm sorry. It's just like me and you, Robin. I'm sorry. To ask another question, but so our blue, our co-payment and our other dental plan, are those the two plans that are within our Florida Blue and Florida Healthcare Advantage plans? It's either or is it just, that's where I get confused with because dental is included in the Advantage plan.
It's okay. So it's under the co-payment network.
Okay.
Yeah. So our standalone dental plans, our PPO standalone dental plans are the choice
Right.
and the choice co-payment.
Okay.
When it comes to the Medicare Advantage plans that include dental,
Uh-huh.
they're going to be the choice co-payment network.
So if somebody asks you, what is the name of the dental plan in my Advantage plan, is that what you tell them?
It's Florida Combined Life, the co-payment plan, the choice.
Okay. Florida
Co-payment
Combined
plan.
Life. Okay.
Mhm.
Okay.
However, I would not just say it's the co-payment network, because the dental benefits are totally different under each plan, and they do not include everything that the co-payment standalone plan includes. Like, for example, the Premier HMO in Duval County has a comprehensive dental plan. It's amazing, but it does not include crowns and root canals. Okay, even though it's under that Medicare plan. So if a client wants crowns and root canals covered, then I have to put them on the separate standalone co-payment plan, even though they already have most of the benefits under the Medicare plan, but they're not paying anything additional for that other than any co-pays that might apply. But so I always download from the evidence of coverage the dental portion, because I attach it to their enrollment booklet, to the booklet that I give them with the summary of benefits, so that they can see their specific benefits that are covered under that plan. Because if you have them thinking they have all this dental coverage, they're going to get charged for things, because the PPO does not cover things like fillings and deep cleanings and things like that. So you want to make sure you know exactly what your plan is covering.
And
And
so, with that being said, Robin, so I had a friend of mine that's I'm getting ready to write an Advantage plan for her, but she's been checking into her the dentist, the dental benefits. And so her dentist told her that he doesn't take Medicare dental. So does that mean he doesn't really understand that it's not actually Medicare dental, it's Florida Combined Life? Or what would you say to that?
I usually tell my clients to avoid saying they have dental under their Medicare plan. And that's one of the reasons I'm kind of disappointed that they didn't send the member a separate dental card like they were going to do, and they canceled that for this year, because that would have been a huge help.
Right,
But
right.
what I usually do is I make sure I look up the dentist on the network where Jamie just showed you. If that dentist comes up under that particular network, then I know that dentist doesn't office, because sometimes it's just the staff that does not understand what the benefit is. So I get on the phone and call dentist office and say, okay, well, I'm showing you on our network for our Florida Combined Life plan. And I tell them, I ask them to give the member number. I try to give them the member number. I always encourage them, just give them your member number. Don't mention Medicare, because it is a PPO, but you can't go out of network because it's under your Medicare plan. But if I give them the dentist and I've already looked them up, then they shouldn't be having an issue with that dentist office.
Okay.
And sometimes they have the wrong rate. Sometimes they're looking at, because remember, Florida Blue has private healthcare plans, employer group plans, and all those are different dental benefits. So when we call them, we want to make sure they understand you just need to check their benefits under their plan.
Okay.
At the end of the day, when it comes to our Medicare Advantage plans, the co-payment plan is just for network purposes only, whether or not a doctor is participating within that network. The benefits, it just depends on the actual Medicare plan, but it's very confusing. They should have just sent the standalone card
Hard.
like
Yeah.
they were going to initially do and then decided not to at the last minute, unfortunately. And now I'm sure they're kicking themselves in the butt. But you know, what's most important is just that they are in that network. It's just the co-payment network that they participate in. But as far as benefits are concerned, that just depends on what is covered under their plan as far as the benefits. So we just need to double check that they are participating within that actual network. And then moving forward, you know, you have all of these, the remainder of the vendors as well. So, you know, you have your hearing, Nation's Hearing, here's the site as well, your over the counter. So for those members that do have over the counter benefits, that's a really great benefit that our members love. They can order, you know, non-prescription over the counter items, depending on what their benefit is. A lot of them is $75 quarterly, depending on. So they'll receive a book in the mail, but they can also call it and go online to the website as well and order. And then you'll have access to the vision as well, which is My Eye Care Health. I'm not going to be able to get to all of these just because we're at the time crunch and I want to get to an actual application, just to show you how to get there because we have some new agents on here. So you'll have access. I definitely recommend navigating through this, but this is a very, very helpful tool. But you'll always have access to that within your Medicare toolkit, but I will definitely send that out. And then you have even more in-depth detail about each particular vendor as well within here. So there's printouts for each. So like dental, the hearing benefit, transportation, diabetic supplies, so which is really, really nice. So there's so much stuff within your Medicare toolkit that I highly recommend going through it. Also, as far as rewards, so I put a little cheat sheet to a link within for our Florida Blue rewards program here. So if you click on here, it's going to bring you to this page here, where it tells you and our members everything they need to know about the Healthy Blue Rewards program. So as you know, the Healthy Blue Rewards program is for members with a Medicare Advantage plan with Florida Blue. And this allows them to earn gift cards along the way for doing certain activities and stuff like that throughout the year. So this is just kind of an overview about how they earn Healthy Blue rewards. And you can actually narrow it down by clicking on the actual Medicare plan. And you can download all of the activities, learn how the Healthy Blue rewards work. It'll allow you to show you how to walk through them registering for their member account and getting to the actual rewards. So here's just an example of what some of the activities look like. So this is kind of like a brochure. And it breaks it down here of the reward value and then where they can redeem their rewards here as well. And then this little link here. Oh, did it just log me out? Hold on. And then if we click on learn how Healthy Blue rewards work, this is an overview of how they can get to the Healthy Blue rewards and how to access them. So this is a quick overview we can either send to our members, walk them through it. And this is a step-by-step for them, which is really, really nice. I do have a question. It's the wrong address, misspelled or anything. Where to call? Can you please tell us when or if we make a mistake on an application such as wrong address, misspelled or anything, where to call and how to proceed? A lot of the times you need to call. If you make a mistake, a lot of the times I'll call Brandon Bureau and he'll tell me what we need to do. But a lot of times they tell us that we need to call agent services when it comes to making a mistake on Medicare. Sometimes they tell us we have to reprocess an application depending on what the mistake is. But the majority of times we do have to call. Now, as far as like a mistake, like are you like like you input the address incorrectly? Because sometimes they don't want us to double app that. Sometimes we have to call agent services and they'll fix it for us. Is that what you mean, Suni?
Yes, like we had a situation with Georgia, and there was a, the client keep getting a mail in the wrong household, and we called agent service, and agent service said, oh, you have to call Medicare. He called, he called the Medicare, and still hasn't fixed. I don't know if Georgia is listening, if she can elaborate a little bit more, but
Oh, hold on. Did she input the address incorrect in Florida Blue, or Medicare has the wrong address?
well, the Florida, all his like any communication from Medicare is he's receiving at the correct address, but any communication that he's receiving from Florida Blue is going to a wrong address. It's just like a couple digits off, like instead of 123, it is 132. Just like just an example on the house number. So it's going to the wrong house.
So it was input incorrectly into the actual Florida Blue application.
Correct. And we called agent service, but they couldn't help. They didn't help. And they said, oh, you have to call Medicare.
That has nothing to do with Medicare because it was input incorrectly. So I've had several times where if I've made a mistake, I've had numerous times where they told me, just depending on how long after the fact that the application was submitted, that I had to submit a new application. And then I've had several people fix it through agent services. I don't know if there's anyone else on the call here that had other experiences.
Actually, we found out after, because it was when the mail was coming, it was going to the wrong address. So it was like a few weeks after when the policy was already issued.
Okay. And agent services, said that you had to talk to Medicare. I'll have to ask Brandon on that one. It's been a little while since I've had, but the last one that I did, agent services had corrected it for me. Does anyone else have any recent experiences?
I just put it in the chat.
Yeah, Brandon is good about that, depending on, so Robin had a scenario where she put the wrong effective date for Part B, and Brandon asked her to email it to him. Depending on the circumstance, he does get internally get a lot of the stuff rectified. So it all depends on the scenario. How about anything else? Anybody else? Robin, have you had any other scenarios? Or is that it?
Yeah, I've had other stuff, and usually when I have an issue, I just ask Brandon, because I wanted to know if I should cancel the application and redo it. He said, no, we'll just fix it on this side. So I think he think it's faster for them to do it. I've had a couple of times where that's what he told me he'd do. And all I had to do was email him like the member name and birth date, and he fixed it for me. He had it fixed.
Yeah, so depending on what
you guys
is, we have Suni, if you run to any issues like that, shoot me an email, and I'll get it to the area manager. Okay, and see what.
Okay, thank you. You guys are so lucky. You guys have Brandon. Yes, like
I love
Brandon.
Brandon.
One time, a couple times, like I had send this information to Miguel, and he said, "Oh, you have to call agent service," and I say, "I already did. There's nothing. I'm not going anywhere." But then nothing happened. So
I know.
I will send it going forward. Thank you.
Yeah, just send it to me. He's super, super helpful, and I know he'll work with any of our agents. He's
amazing.
Yeah, that's just the type of person that he is, and he gets it done like quick. So, all right. So real quick, I'm gonna show you how to get to the application process real quick. So when we're on our homepage on Agent Point, we're gonna click on My Business. Just a couple things, like any of our members, you always have access through Member Insights. Because of HIPAA, I'm not going to get into that, but if you click on Member Insights, you can click on your actual member name. If you start typing in, your members will come up and you'll have access to their information. It'll also allow you to print out a temporary ID card as well. If you're trying to find out whether an agent has like an AOR, or whether a member has an AOR, if they're not new to Florida Blue or they're not sure or whatever, you can start typing in an actual, let me see. Of course, my thing doesn't want to work. Last name, and if it doesn't come up, you can click on aligned agency search. And you can select over 65 and you can type in the actual first and last name, date of birth, and then search, and it will tell you whether or not they're with Florida Blue, so no active contract found, but then it will also tell you whether or not they have an actual AOR. So it'll tell you the agency they're aligned with. It won't tell you the actual agent, but this is really nice. So this will help determine whether or not somebody already has an AOR. So that's through your aligned agency. And again, you access that through your My Business tool and Member Insights. Once you start typing in the member name, if it doesn't come up, it'll give you that aligned account. So if you start typing in a name again, then click on aligned agency. So that's super, super helpful.
Yeah, and if it doesn't come up, it means you're not the AOR and not going to get paid. Better make sure you get it on there.
And then, all right, so to get to the application, the nitty gritty, after you do all your work and stuff and you're ready to enroll, all of your Medicare, whether it's Florida Blue or Florida Healthcare, is going to be under quote Florida Blue. So you're going to click on quote Florida Blue. And in the middle right here, we're going to click on create new proposal. And we're going to type in their first, last name. I mean, all of this is optional. If you want to put their hospital effective date here, it'll automatically transport into the actual application, but you can leave it blank for now. Then you're going to put in their date of birth, their zip code, county, whether or not they're a tobacco user. We're going to continue. The Medicare Plan Wizard asks a whole bunch of questions. It'll kind of narrow down what they think is best for this particular member, but we're just going to continue. And then if we're doing a Medicare Advantage, we would want to keep that highlight. If we're just doing a standalone prescription drug plan and a supplement, we would highlight those, but we're going to just do a Medicare Advantage plan. So we're going to deselect those. Sometimes it'll automatically generate a Medicare Advantage plan here, but to see all plan availabilities, we're going to click on action and add a plan. And then we're going to select the appropriate plan for our member that we're going to enroll them in. So all of these plans are available. Of course, we already narrowed it down. We're going to select the actual plan and we're going to update proposal. To the right here, we're going to select the radio button to the left, but to the right here, this is where we can find the scope of appointment for Florida Blue and Florida healthcare plans as well. So print version, we would click on the PDF and it will populate a scope of appointment so we can print it out for them and just have them sign it, or whatever it is that you will, but you'll always have access to the scope of appointment that way. Or we can click on generate scope of appointment. And what this is an electronic version. It will automatically, once you click on generate scope of appointment, you need to make sure you input an email address on the original page that you were typing in their first and last name, the page before this, and their zip code and whether they're a male or female. But when you select generate scope of appointment, what it's going to do is it's going to email you a copy of it first for you to click on the box that needs to be check marked for their initial. And then on next page where you're going to put your information as the agent and fill that in, and then and sign it electronically. And then once you submit that on your end, it's going to automatically shoot it over to your member for them to e-sign. And then once they e-sign, Florida Blue is going to send you a copy of it. So that's quick and easy. And that's something that I'm really glad that they incorporated. So you'll always have access to that. And that's for both Florida Healthcare and Florida Blue. So depending on which plan that you're selecting here on the left-hand side, that electronic version of the scope is going to be either for Florida Blue or Florida Healthcare plans. All right. And then once you click apply now, you're going to click on English or Spanish, and it's going to ask you all of these options. So whether they're new to Medicare, if they're enrolled in the Medicare Advantage plan and are making a change during the Medicare Advantage open enrollment period, which is where we're in now, until from January 1st to March 31st every year. So those that already have a Medicare Advantage plan have one more opportunity to switch to another Medicare Advantage plan. So you want to select one of these options if they've recently moved out of the service area for their current plan and moved into a new service area if they're leaving employer or union coverage. So there's all of these different options. So once you've selected, I'm going to select the enrollment period, you're going to save and continue. Now, this is just an application checklist. And you're going to continue. Let's see this. All right, so you're going to salutation, whoops. If they have a middle initial or middle name they want to use, if there's a middle initial on their Medicare card, I usually input that here. Address, you want to put the address here. Mailing address, whether it's the same or not. If they have a PO box, you could put none of the above, and then it will generate another option for you to put the mailing address, home phone number. If they want to put an optional phone number, email address, that's entirely up to them. Spoken English if they want to, if they are the applicant completing this application, save and continue. Their Medicare number, that's where the number is going to go for Medicare, the effective date. I'm not sure if it'll let me move forward without the Medicare number, but to the best of your knowledge, are you enrolled in your state Medicaid program? So if they do have Medicaid and you select yes, it's going to ask you for their Medicaid number. Save and continue. Oops. All right, so let me move forward. Are you a resident in a long-term care facility, such as a nursing home? Do you or your spouse work? And they ask this question because if they currently have coverage from an employer or union, this is just saying that by joining a Medicare Advantage plan, it could affect their employer or union health coverage. So they could lose employer or union health coverage if they join one. So they need to contact their HR department. Save and continue. Primary care physician, if they have a primary care physician that they use, you would input their information here, or one that you want to get assigned to, you would put that information here as well. Save and continue. And then will they have other prescription drug coverage, such as, TRICARE, VA benefits, and so on and so forth. That's where that information would go here. Save and continue. This is just saying the effective date is going to be determined by CMS. So if we did the application now during the open enrollment period, we are going to get a March 1st effective date. But depending on if they're new to Medicare and they were aging in and their Medicare goes into effect May 1st, then their effective date would be May 1st. Save and continue. Whether we're doing it in person, web conferencing, or email. If we're doing it web conferencing like we're doing now, we would select that and we would put the vendor name like Zoom and put the session ID that you're given. If you're doing it by email, what's going to happen is they're going to be sent an email and you're going to give at time of submission, you're going to get be given a passcode. And then that email that they receive on their end, they're going to have to input that passcode in order to get into the application for electronic signature. And for the most part, the electronic version for them is simple. The only thing that sometimes gets confusing is when they get onto the first page, they have to review the application, which they have to click on the review link, and it will generate in another pop-up on most, depending on how they're accessing it. If it's like a tablet or a phone or whatnot, it'll generate a new pop-up, and that page is literally just for review purposes. And then they would either minimize that, but they need to go back to the original page that they were on in order to check that everything looks correct to move forward to the next page to get through the e-sign process. So it's pretty simple for the most part. It's just the first page. It's a little confusing because that review link does populate in a new page, and sometimes people do not understand how to get back to it. I wish I had the capability of showing you that, but I don't. Or in person. Of course, in person is the easiest. So if you're doing it in person, which we'll say that we're doing right now, we're going to continue. And then recurring billing information. So if a plan does have an actual premium, this is just giving you options on how to take that premium out, whether it's an electronic funds transfer, if they want to get a monthly bill or have it automatically deducted from their Social Security or railroad benefits. No matter what, whether it has a premium or not, you still have to choose one of these. So even if it has a zero premium, you still have to choose one of these. So this has a zero premium. I'm just going to choose get a bill. Even though they're not going to be billed anything, you do have to choose one of these in order to move forward. And then these are agent acknowledgements, whether or not we're related to the applicant. If there's still policies in force, if you select yes, you could put currently has a Medicare Advantage plan with Humana, changing to Florida Blue or Florida Healthcare Plan during the Medicare Advantage open enrollment period. Or just say they're new to Medicare and they have an under 65 marketplace plan. A lot of times I'll put currently has a plan through marketplace ending on March 31st due to new to Medicare. So whatever notes you want to put in there, it's entirely up to you. And whether or not there's policies issued in the past 5 years that are no longer in force, agree, disagree. If you have any remarks, sometimes in here I'll put just say they're transitioning from just say under 65 to Medicare, or if they use a certain primary care physician and that primary care physician isn't accepting new patients, I'll put a current patient of Dr. Smith or whatever. Save and continue. And then review application. So this is something that you have to go through. You need to review that application with the member, make sure everything looks appropriate, that you're enrolling them in the proper plan, the qualifying event, their personal information. So make sure everything looks correct before you submit. You know, this is just everything that we already had gone through. You just want to make sure that everything looks correct. And then once it does, you're going to click everything checks out, close window, that Jane Doe is the individual on the application and everything is true to the best of their knowledge. If executed by legal authorization, which she does not have. And then this is just agree to everything that was already in the actual application. If they have coverage through an employer, they risk losing that. They must have A and B and keep A and B. That at the beginning on the date of FHC Medicare begins, they must get all their health care from Florida Healthcare Medicare or Florida Blue, of course, whatever it is. So you just want to go through all of these with them. FHC Medicare serves a specific area. If they move out of that area, you know, they need to notify the plan so they can disenroll and find a new plan, and so on and so forth. And then the date of birth will go here. And then you'll agree and you'll submit that application. Now, I'm not going to submit it obviously because it's a generic app, but once you submit that application, you're going to have the option of clicking on enrollment checklist. So once submit application goes through, there's going to be a little hyperlink that says enrollment checklist in the middle of the page, which an electronic version of the enrollment checklist where you can input their doctors, input their prescriptions, all those yes or no questions that you can select. So once you initiate that or click on that hyperlink, it's going to be emailed to you again as the agent first, and you can fill in all of those details and you'll sign it as the agent. And then it's going to be sent over to the member for them to review and e-sign it. And then Florida Blue will send you over a copy so you have it for your records. So it's pretty simple for the most part, very simple application process, actually. And I know we're running over time allotted, but does anyone have any questions regarding the application process? And then we are going to wrap it up. I know it's a lot of information today. All right, guys. Well, if there's no more questions, any comments, now would be the time to speak up.
No comments other than thank you, Jamie, for your time and always putting together some awesome training information for us to be, grow and be better as agents.
Well,
Thank you, Jamie.
You're welcome. I appreciate you guys attending. If you need anything, you let me know. In the meantime, I'm going to send out that cheat sheet and a couple of other things. And I will talk to you guys soon. You guys have a wonderful weekend and be safe and well. Bye, guys.
You too. Love you, Jamie.
Bye.
Love you guys too.
Bye.